Welcome to a crucial journey on understanding first aid. Let's dive right in. First aid is the immediate care provided to a person suffering from an injury or illness before the arrival of professional medical help. It's a skill that everyone should have a basic understanding of, as it can make a significant difference in an emergency situation. Knowing first aid can help you effectively manage a situation, prevent further harm, and potentially save a life. The key principles of providing first aid revolve around three primary goals. Firstly, to preserve life by stabilizing the person and addressing any life-threatening conditions. Secondly, to prevent further harm by ensuring the person is safe from any additional injury. And finally, to promote recovery by providing necessary comfort and support. As you'll soon discover, knowing first aid can be the difference between life and death. Diving into the world of first aid, we start with the basics. First things first, assessing the scene. It's crucial to ensure your own safety and the safety of others. Look around for potential hazards like fire, falling debris, or traffic. We can't help others if we become victims ourselves, right? Next up, assessing the victim. Is the person responsive? Try calling out to them or gently shaking their shoulder. Unresponsiveness could indicate a serious problem. Now check for breathing and circulation. Look for the rise and fall of the chest. Feel for a pulse. If you can't detect either, we're looking at a potential cardiac arrest and immediate action is necessary. Now let's talk about calling for professional help. Knowing when and how to activate emergency services is an essential part of first aid. If the person is unresponsive, not breathing or struggling to breathe, has severe bleeding or is showing signs of a stroke or heart attack, it's time to dial your country's emergency number. When you call, remain calm and provide all necessary information. Describe the situation, the location, and the condition of the victim. Follow the dispatcher's instructions and stay on the line until help arrives. In the meantime, you can provide vital first aid. Remember, the goal here is not to replace professional medical help, but to preserve life, prevent the condition from worsening, and promote recovery until help arrives. You might be required to perform chest compressions, stop bleeding, or even use an automated external defibrillator if one is available. The world of first aid might seem overwhelming at first, but with knowledge, practice, and a calm demeanor, you can make a real difference. You can potentially save a life. That's the importance of these basic first aid skills. Remember, assessing the situation correctly is the first step towards effective first aid. Next, we explore the life-saving technique of CPR. When the heart stops, every moment counts. That's where cardiopulmonary resuscitation, or CPR, comes into play. It's a skill that can keep someone alive until professional help arrives. Let's begin with chest compressions. Place the heel of your hand at the center of the person's chest. Place your other hand on top, interlocking your fingers. Keep your elbows straight and use your body weight to compress the chest at least 2 inches deep at a rate of 100 to 120 compressions per minute. That's almost 2 compressions per second. Now, on to rescue breaths. After 30 compressions, give 2 rescue breaths. Tilt the person's head back slightly to open the airway. Pinch the person's nose shut. Take a normal breath. Cover the person's mouth with yours. And exhale until you see the chest rise. Remember, it's 30 compressions and 2 breaths. But what if you're dealing with a child or an infant? For children, use 1 or both hands for chest compressions, depending on the size of the child. The compression depth should be about 1/3 of the chest diameter, or approximately 2 inches. The rate remains the same. For infants, use 2 fingers to deliver chest compressions at a depth of about 1.5 inches. Give 2 rescue breaths after every 30 compressions, just like with adults and children. The key is to recognize and respond to age-related emergencies. An adult's heart might stop due to heart disease, while a child's might stop due to respiratory issues. An infant, on the other hand, might need CPR due to sudden infant death syndrome, or SIDS. Remember, CPR is not a cure. It's a temporary measure intended to keep the blood flowing, delivering vital oxygen to the brain and other organs until professional help arrives. CPR is a vital skill that can save a life before emergency services arrive. So learn it, practice it, and be ready to step in when it matters most. Moving on, we tackle 2 common emergencies: choking and bleeding. These are situations where you might be the first responder and your actions can make all the difference. Let's start with choking. Choking occurs when an object blocks the throat or windpipe. Adults often choke by inhaling food or small objects. Infants, on the other hand, can choke on anything they can fit into their mouths. Recognizing the signs of choking is crucial. Look for clutching at the throat, inability to talk, difficulty breathing, or turning blue. Now, if the person is conscious and choking, the Heimlich maneuver is your go-to response. Stand behind the person, wrap your arms around their waist, and make a fist with one hand. Place your fist slightly above the person's navel, grasp your fist with your other hand, and give quick upward thrusts. But remember, different age groups require slightly different techniques. For infants, you'll use back blows and chest thrusts instead. For pregnant individuals or overweight people, you'll perform chest thrusts instead of abdominal ones. Now, let's talk about bleeding. Controlling external bleeding is an essential skill. Your first step is to apply direct pressure to the wound. Use a clean cloth if available, and keep adding more layers if blood soaks through. If possible, elevate the wound. For severe bleeding, you might need to use pressure points. These are areas where blood vessels are close to the surface and pressure can help control bleeding. For instance, the brachial artery in the arm or the femoral artery in the leg. And finally, let's cover dressing and bandaging. Clean the wound with warm water and mild soap if possible. Then cover it with a sterile dressing or bandage. There are many types of bandages available, each suited to different kinds of injuries. Remember, the goal of bandaging is to protect the wound, control bleeding, and prevent infection. Quick response to choking and bleeding can prevent further harm and save lives. Knowledge, as they say, is power. And in this case, the power to save a life. In this segment, we delve into burns, fractures, and medical emergencies. First off, let's discuss burns. Burns can range from mild to severe, and it's crucial to know how to assess the severity. Minor burns like sunburns or small kitchen mishaps often appear red and painful. More severe burns can blister, char, or even appear white. Immediate first aid for burns involves cooling the area with cool, not cold water, and covering it with a clean, non-stick bandage. Next, we talk about fractures and sprains. These injuries can be surprisingly tricky to identify because symptoms can vary widely. A fracture might be evident with visible bone, but often it's not so clear. Pain, swelling, and difficulty moving the affected area are common signs. If a fracture or sprain is suspected, immobilize the injured limb if possible, and provide comfort while waiting for professional help. Remember, never attempt to realign a suspected fractured bone yourself. Finally, we'll touch on recognizing symptoms of common medical emergencies. Heart attacks, for instance, can involve chest pain, shortness of breath, and discomfort in the upper body. Strokes might be recognized by sudden confusion, trouble speaking, or weakness on one side of the body. If you suspect a medical emergency, provide comfort and support while activating emergency services. It's important to remember that while first aid can provide immediate relief and potentially save a life, it's not a replacement for professional medical help. Always call for professional assistance when dealing with burns, fractures, and medical emergencies. You're not expected to do it all, but your actions can be the critical link that buys time until medical professionals arrive. Finally, we look at first aid kit essentials and the importance of training. A basic first aid kit should contain items like adhesive bandages, sterile gauze pads, adhesive tape, tweezers, scissors, antiseptic wipes, and a breathing barrier for CPR. While having a well-stocked first aid kit is a great start, it's equally important to know how to use these tools effectively. That's where formal first aid training comes into play. Seek certification from a reputable organization and make an effort to keep your skills fresh with regular refreshers and updates on first aid techniques. With knowledge of first aid, you're not just a bystander but a potential lifesaver. Take the time to learn, practice, and refresh these skills. You never know when you'll need them.